Welcome back to Suncoast View. So we live in an amazing area to be active in places like golf courses and tennis courts. Unfortunately, our bodies can't always keep up with all of our activities. So Dr. Stephen Otte is a shoulder and elbow specialist with Coastal Orthopedics, and he's here to explain some of the typical aches and pains that we feel from sports. Welcome, doctor.
Thanks for having me.
And I love it, too, that you personally are no stranger to a golf course. Tell us about your role at the Sarasota Open. This is cool.
Yeah, I got asked to be, from our group, the physician for the tournament, the Sarasota Open professional tennis tournament that was here last week. And so, my role really as the on-site medical director was to evaluate any either on-court injuries or players that were injured and needed to withdraw. The ATP requires a form gets filled out, and so I was really there to just provide support for the athletes if injuries came up, and evaluate anything that came up during the week.
Well, and especially with tennis, a lot of stopping and starting, a lot of different things, that can go wrong. So if professionals are worried about injuries, that makes us weekend warriors probably a little bit extra susceptible. What type of injuries do we most often run into with either, golf course weekends or tennis matches?
Yeah, especially as a shoulder and elbow specialist, and especially with golf and tennis specifically, the main things that I look at or that I see are rotator cuff injuries with the shoulder, and then everyone's probably heard of somebody that's had tennis elbow or golfer's elbow. And so, really these are overuse injuries, and so the more we can stretch and limber up our bodies before exercise, the better chance we have of preventing these things from happening.
All right, so Mike, how's your wicked serve? The rotator cuff still in there for you?
I haven't done this in a long time.
Yeah, all right, so there's the motion. Where does the problem come in?
Stiff.
Yeah. He just said you were stiff.
I hope he was talking about my muscles
and
my personality.
And one of the things that I found, especially watching the professionals, is they didn't just go hit 400 serves.
Right.
They spent an hour getting warmed up, stretching, jogging. Their tennis serve specifically is so much predicated on their lower body, their back, the flexibility that they get, and when we lose that, both as we age or we don't warm up, it becomes just a pure arm motion, and that's where rotator cuff and elbow issues come into play.
So when we talk about specifically elbow, how am I going to stretch the elbow, right? If I'm working on my golf swing, that's one thing, but is there something I can do before I head out to the course that's going to help these tendons and ligaments?
Yeah, and believe it or not, there are actually some really good dedicated elbow stretching exercises. All the muscles and tendons on the front and the back of the forearm come and attach on a small little area, and so that's why, as all these muscles come and attach in one little spot, and so that area is really susceptible to getting overused and injured. And so there are some actually, and we at Coastal Orthopedics, we have a robust physical therapy department that deals with these injuries all day, every day, and so they have a really good system for treating these injuries. And there's a lot of stretching, there's some modalities with ultrasound and other things that we can do to alleviate pain in that area.
You see people all the time, they have tennis elbow, they have some sort of a brace or patch. Does that do more harm than good?
No, it certainly doesn't do any harm. And what I usually counsel people on is, especially with tennis elbow, 95% of the time we can treat it non-operatively. And so whatever makes it feel better is fine. Whether it's mental or actually doing anything is irrelevant. As long as it gives you some support or you feel as though it's making a difference, that's all that matters.
Do you ever actually, get into the sport enough with a patient to, like if Mike were to bring in a racket, or I run into it more with golf, where somebody actually took a look at my motion and was like, well, that's why your elbow hurts. I was like, man.
That's cruel.
Yeah, that was cruel, but helpful.
To give it back to our physical therapy department, we have I think 3 or 4 different therapists that have gone through. The Titleist has a performance institute, and they actually have a dedicated program that you have to get trained and certified through, called the Titleist Performance Institute, and we have several therapists that are trained in this specifically, and so you can bring in a golf club and they will show you, where's your mechanics getting thrown off and why it is potentially downstream leading to injuries.
Right, because if you do something wrong over and over and over, no doubt it's going to end up hurting your body. So what what is your advice to all of us who, probably have some twinges and pain, and when when it goes beyond the, I can take some, ibuprofen and move on to the, I probably should have this looked at?
Yeah, playing with, the old adage of playing with pain is different than playing through pain.
Yes.
And so having an ache and pain, if it goes away with Tylenol or ibuprofen, it's probably okay. If you're really hurt, it's probably either time to take some time off or get it evaluated.
And as you said, a good percentage of that doesn't mean surgery.
For sure.
So I feel like we're all trying to avoid such things.
Of course.
How do you feel about the 19th hole or the beer card that's rolling out? Because
It can also hurt your elbow.
No, that's very true.
Repetitive use,
Yeah, exactly. But if you're drinking while you're golfing, you can't really do it as much in tennis. But is that helping you or is that hurting you?
If it loosens you up a little bit, you might argue it helps you in a degree. Probably too much is not advised.
Okay.
It's not going to help your score. Just, it's my general consensus, what I've noticed
It'll
on
make
that.
the day go by a little faster.
I mean, my best advice is a thorough warm up. We as amateurs don't have time, generally speaking, to go stretch for an hour and then do have somebody give us a massage before every time. But it's probably more beneficial, instead of going out to the range and hitting 100 golf balls, it's probably more beneficial to stretch out, make sure your back's stretched out. To help avoid those upper extremity injuries, for sure.
Yeah, I think that's why they call it Weekend Warrior. We think we can go out and be rock stars occasionally.
Go right to the first tee.
Good point that the professionals definitely put in a lot of time and strength training to get to where they're at.
For sure.
All right, well, the aches and pains are going to happen, so when you need some help, you can find Dr. Neff and his team by going to coastalorthopedics.com. Coming up,